For each generation, we will display several important organisms that may or may not be susceptible to that group of cephalosporins. Cocci will be found on the left, while bacilli will be on the right. Organisms in purple boxes are gram-positives, while the gram-negatives are in the pinkish boxes. If susceptible to a particular generation of cephalosporins, the organism will lie within the green area, while those that are not will be in the red area. While there are always exceptions, we will look at the most widely accepted patterns of antimicrobial activity. And for the sake of simplicity, other types of organisms, such as spirochetes, will only be mentioned when relevant. Now we will begin with the first generation of cephalosporins. At the bottom of the screen are a few representative antibiotics. The first generation of cephalosporins is effective against most gram-positive cocci, including aerobic streptococcal species and methicillin-sensitive Staphylococcus aureus. Cephalexin is an oral first-generation cephalosporin. Like the anti-staphylococcal penicillins, it is an excellent choice for skin and soft tissue infections, such as uncomplicated cellulitis, when the suspected pathogen is streptococcus or a susceptible strain of staphylococci, in this case, not MRSA. Cefazolin is an intravenous first-generation cephalosporin that is widely used for perioperative prophylaxis to prevent surgical site infections. None of the first-generation cephalosporins, however, are helpful for any of the gram-positive organisms in the red area below, including penicillin-resistant pneumococci, methicillin-resistant Staphylococcus aureus, enterococci, and listeria. As you will see, lack of activity against enterococci and listeria species will continue throughout this lecture. As alluded to earlier, these agents do not have extensive gram-negative coverage and are not effective against any of these organisms in the red area. They do, however, provide some coverage against gram-negative enterics, including E. coli, indole-negative Proteus mirabilis, and Klebsiella pneumoniae. When the organism is susceptible, these agents can treat, for example, a simple urinary tract infection. Activity against other types of organisms, such as anaerobes, intracellular bacteria, and spirochetes, is poor. It is also important to note that none of the first-generation cephalosporins sufficiently cross the blood-brain barrier and thus cannot be used for meningitis and other CNS infections. Now don't worry about memorizing these details. The last slide will summarize this lecture on a single flashcard. For now, I recommend just following along and letting important concepts slowly sink in. For example, Cephalexin can be used to treat uncomplicated skin infections, much in the same way as an anti-staphylococcal penicillin. Cefazolin is commonly used for perioperative prophylaxis, and when an organism is susceptible, first-generation cephalosporins can be used to treat infections due to gram-negative enterics, like a simple UTI. For more information, check out our full lecture on the spectrum of activity of the cephalosporin antibiotics.